Welcome back to Healthcare Rounds, your insider access to the healthcare industry. I am John Marchica, CEO of Darwin Research Group. Super excited today about our conversation with Dr. Erika Ebbel Angle, who's co-founder and CEO of Ixcela. And she received her PhD in biochemistry from Boston University School of Medicine and also holds a BS in chemistry from MIT. Boston Business Journal selected her as one of the 40 under 40 business and civic leaders who are making a major impact in their respective fields in the Boston area. So welcome, Erika. Thanks for taking the time to do Healthcare Rounds.
Thank you for having me, John.
Well, I started with your academic credentials, but maybe just talk a little bit about your background and got to what you're working on today. And then we'll dive right in after that.
Sure. So by training, by education, I am a biochemist. So my undergrad degree is in chemistry from MIT, and then have a PhD in analytical biochemistry from Boston University School of Medicine. Now currently more sort of on the entrepreneurial side, working on Ixcela and looking for ways to help solve complex medical challenges and help people suffering from a wide variety of different challenges and issues with this really cool and cutting edge test that Ixcela has invented, tested now in a whole variety of different populations. So really looking to help with some of the healthcare challenges that many individuals and society is facing today.
Which leads us to kind of like the key point here, right, about Ixcela, which is the gut microbiome. And I was wondering if you would please take some time and talk to us a little bit about, the role that the gut microbiome plays in cancer treatment or in other things, but maybe just sort of start there and why you've locked into this area for Ixcela.
Wonderful question. So, to begin with, for those who may not be familiar with the gut microbiome. So what is it? So from entry to exit, it is everything from mouth to exit, all the critters that live in this giant tube. So your digestive system is comprised of, you have your mouth, your esophagus, your stomach, your small, your large intestine. Basically, the microbiome is all of the trillions of critters that live in there. And they're responsible for many, many, many things, from your immunity, your immune system, the strength of that, from your energy to how you process your nutrients, to how you cope with stress. It really is just interrelated in so many different areas. We think of the gut as just being like this independent system, but in reality, no, it is very much intertwined and intermeshed in everything, in all different systems' health. And specifically as it relates, to cancer, pick a condition, but let's start with cancer. It's very important in a variety of different ways because one, as a patient is going through various types of treatments, obviously a lot of research is showing that the stronger and the more robust the health of the microbiome is, the better your chances of success and outcomes in your treatments and therapies, many of which are very, very challenging on the body, really pushing the body to the extreme of what it can handle and take. If your gut microbiome is more robust, if your immune system is stronger, you're more likely to have a more positive outcome, less side effects, less, feelings of ill feelings on the back end. So, really research is pointing to the significance of having a strong and diverse microbiome in your ability to, both endure the various treatments that you have to cope with and handle as you go through therapy, but also with outcomes as well.
So you're a biochemist. Can you help us out a little bit and just talk to me a little bit more about the science of why this is so important? What is it about the gut microbiome? What is it about this sort of, ecosystem inside of us? Start thinking about this and I get grossed out. I don't know why. It's just your stomach, right? But what is it? What's the science behind it that would, where you would find this kind of a link to even think to start discovering it, right?
Right. So let's we'll have a few examples, right? So for example, you have these trillions of different microorganisms, bacteria, fungi, viruses, all living predominantly in your small and large intestine, but everywhere. They form a very complex, what we call a Darwinian competition state or an ecosystem where they're all vying for competition to survive inside your body. So, when we talk about good and bad bacteria, that's kind of a misnomer in a way because, you want things to be in the right proportion with each other. You don't necessarily want if you say this one's bad and this one's good, but if you eliminate the bad, then you have another problem because they do serve a purpose. So it's this diversity, it's the proper ratios of having the right types of things in there, and that's actually very complex because the minute you disrupt that the ecosystem, you start having challenges where, well, now I've eliminated this species of bacteria. Oh no, that was actually really important because that's the one that allowed me to digest, the pizza that I ate last night. Now I can no longer get nutrients from cheese or whatever. I mean, I'm just giving an example. So
Yeah.
maintaining a very, very diverse and functional, ecosystem in the gut is super important because each bacteria, each fungi, each critter has a very specific function and role to play. They break down many of the nutrients that you consume through your diet, through your food. So if you don't have the right types of bacteria, you're not getting that nutrition breakdown. Other bacteria actually convert those nutrients into other molecules that then get shuttled around to different areas of the body, whether it's to your brain to help with neurotransmitter communication, whether it's through your small intestine and activating your immune system to be able to fight off pathogens, whether it's to help you sleep. I mean, at the end of the day, these molecules, they all start with typically what you intake in your diet are broken down by these critters in the gut, and then they're able to be shuttled to different areas of the body to help with inflammation, sleep, anxiety, stress, constipation. I mean, everything, right? So why is it important? Well, it's important because it is sort of the sensor communication network where everything that is taken in from the outside, and you think about it, right? We eat this food, is processed, converted, and turned into messaging that ultimately informs all the different systems of your body as to what needs to be done. There's some really great examples, for example, with your intestine. So let's take your intestine. Your intestine is a tube, and there is only one little cell of thickness between in that sort of intestinal epithelial layer. One. So it's really easy to damage this because it's so thin. And then in that, you have these projections, finger-like projections that are called villi. And each one, the purpose is to expand the amount of surface area you have as food and particles are traveling through so that the bacteria that live here are able to absorb all the goodies that travel by, basically. Now, if you damage the intestinal epithelial layer, things that can happen. One, well, you can have what's called intestinal permeability or leaky gut. This means that things that are not supposed to be traveling outside of that tube suddenly start to filter through. Things like, again, maybe other bacteria, pathogens, viruses. So you're more susceptible, more likely to get sick. Or food particles. Food particles can travel in, creating a weird autoimmune response. You end up with food allergies, sensitivities, et cetera, because they're not supposed to make it through that layer. And that can cause autoimmune conditions. It causes other, adverse effects. So again, it's very complex because depending on the problem that you're trying to solve, whether it's improving your digestion, whether it's improving the nutrition that you're actually able to absorb, whether it's decreasing inflammation, whether it's improving the conversation that your brain has with your gut, you have all these different processes happening as a result of all these bacteria, these critters, the nerves that connect your brain and your gut, your immune system really cohabitating there. It's all there. And so it's really not surprising when you think about, if we were talking about, cancer, for example, how important this is if you can decrease the amount of inflammation, increase the robustness and the strength of the gut, that you're going to have better patient outcomes on a whole variety of different fronts. Maybe that's too much, too little. I don't know.
No. I was just going to say that is like the perfect explanation for maybe the healthcare person, but the non-scientist that's listening, right? So the premise then is gut health, I mean, simplified, oversimplified, I imagine, but equates with good health in other areas.
Absolutely.
And when you're treating someone for cancer, an externality of that might be poor gut health for whatever reason. And if you can improve gut health, then potentially you can have better outcomes, and maybe not curing cancer, but certainly the process of going through cancer treatment and things like that. Did I accurately?
Absolutely correct. Right. And when you as a cancer patient, you go in and the oncologist or, surgical oncologists, their purpose is to eradicate the cancer by any means necessary. Right. And the challenge is that in the meanwhile, the individual, right, is left in a place where, what should I do? I feel terrible. I have brain fog, exhaustion, nausea, vomiting, GI issues. I don't sleep well. I have all of these different, symptoms that are happening as a result of my treatment. And nobody is really focusing on that, right? I mean, I think we have this analogy where we talk about how the cancer doc is like the Navy SEAL. They come in and they destroy the cancer, but in the meanwhile, a little crater now is left where they did the job.
Mm-hmm.
And the individual now is, has to figure out, right, after maybe 2 months of treatment, now they have a lifetime to try to figure out, what do I do next in order to keep my body healthy, in order to come back to where I was, to feel better? And that is where you have to support on the outside with diet and nutrition and mindfulness and lifestyle changes. These are the things that, folks really want to understand how to do and what to do in a way that's as hyper personalized to their own condition, because everyone is so very different as
of course.
people. And hence, the gut microbiome is just such a wonderful starting place because everyone's gut is different. And in understanding it, in understanding what is missing, what could be improved, you're able to create these personalized programs for people.
So that's a perfect segue to the, which is one of the reasons I wanted to talk to you, the results that you had from the pilot program at Roper St. Francis healthcare system. And so walk me through, because I have some of the statistics here, but before we get into the results, talk to me about, well, what was that pilot? What was that program? What were you trying to accomplish? And then how did people get into the program? What were you measuring, and so on and so forth?
Yeah, it was an interesting opportunity. Roper had been looking for a program because I think they were realizing themselves how important it was to have a holistic way of treating cancers. Not just, to my point earlier of obviously the eradication of the cancer is so important, but the support of the individuals on the back end, and realizing as well, people don't know what to do. They get asked, right, all the time, what should I do? How can I be doing something in a way that supports my needs? And, and then from the hospital perspective, when folks aren't feeling well, they miss treatments. They have to go to the ER. They have to see their physicians, right? So there is a lot of pressure on the hospital system. And there was a question, could these be alleviated? If there was a program that actually addressed these issues that the patients were feeling, could some of those pressures be made less? And could we help to, maximize the positive outcome from the patient, for the patient? And so, we ultimately heard about this. We applied, we were selected to do this pilot with the hospital. And I think, we had a variety of different goals in mind. From our perspective, obviously, was the program successfully able to reduce some of the symptoms that are commonly felt by people who are suffering and going through these, active treatments, but also sort of post-recovery with certain cancers, breast cancer, folks go into sort of hormone therapy, and that can last for years, 5-10 years. So even though the treatment itself is short, they're in this for a long, long time. But, we were looking at things like brain fog and fatigue, energy, GI issues, all GI, constipation, diarrhea, gas, bloating, energy, sleep. The hospital was looking at things like missed therapies or readmissions, or how often did they have to go to the ER as a result of diarrhea or other GI related symptoms, which is very, very common. And so this was a year-long, essentially, by the time all was said and done, it was about a year-long program. We worked with the oncologists and the lead oncologist who became interim CEO during the time of this. Now is the COO of the hospital, who was very supportive. And folks were brought in a sort of a rolling admissions where the doctors would refer them. They would have to be willing to participate in the 90-day pilot programs. And, we enrolled several dozen folks and went through the whole program with them. And then at the end, obviously looked at the outcomes and the data. And what was amazing was how successful the program was, how much the patients valued it. The data, of course, itself, which was very strong, suggesting that the program helped to reduce all of the symptoms above that I had mentioned, how, the hospital saw value in it from their perspective as well on the topics that I mentioned. And the testimonials, which, every time I watch these videos, and we have dozens of testimonials, videos from patients about how significant this was. And I think that's extremely important, because we can talk stats all day long, but if people are willing to talk about how life-changing it was for them, that means something, I think.
Of course. So, the specifics of the program, they start off and they get a blood test, right? That's the first place. And what does the test tell you?
Right. So it's a pinprick blood test. So you poke your finger and you bleed about, it's exactly 21 microliters, but it's about 3 drops of blood onto a little, right. Looks like a little glorified Q-tip. And you send that in to us. We process it. We look at 11 different molecules that are associated with sort of 3 different areas of gut health. So one is the diversity of the microbiome. So do I have the right types of bacteria in there? Or are they kind of, do I have too many of one kind or another and not the right kind, basically? So you've got the diversity of the gut, looking at the health and integrity of the gut lining. So some of the molecules that are produced tell us that the gut is, properly populated so that your gut lining is in good shape. So there's several of those molecules. You have what we call the nutritional molecules. Things, am I getting the right types of nutrients from my diet? So again, these are typically in the tryptophan pathway. So tryptophan is an essential amino acid. It comes from your diet. You can't get it anywhere else. You have to consume it. And a series of our molecules are actually, one is tryptophan, but they come from tryptophan, and bacteria convert that tryptophan into a variety of other things. And that tells us something, right? So is there an issue with the gut health? Is there an issue with your protein intake? Is there an issue with stress and inflammation? So depending on the levels of all the different molecules, it tells us a story about what's going on with you. And the last set of molecules are in the purine pathway. So this is things that are inflammation markers, sort of in the uric acid pathway. So it tells us, are you just chronically inflamed, stressed out? Physical or emotional stress can contribute to elevating these markers as well. So again, with the 11 markers, it paints a picture. What is going on with this person? Is it a gut issue? Is it a nutritional issue? Is it a stress, issue? And then it helps our dietitians, all of whom are medically supervised, to be able to provide customized solutions for the patients to say, okay, we need to start here because this is where the problem is. And then let's design a customized program for you based on this data of what you should be doing. to get your gut back into check.
So once you identify those things, sorry to get into the weeds here, but what I'm trying to do is, create a story here, or to understand the story here, so that the folks who, many doctors listen to this program, so that people understand this isn't voodoo science. This is like the real stuff that we're doing. This is not, snake oil that we're talking about here. This is, reality based. And so when you get this information and you have the results of this test, what is prescribed then, and when you're working with them on an individual basis, is it a nutrition plan? Is it an exercise plan? Like, what exactly informs you from the test to tell you, okay, they need this? And then what does that look like over the 90-day period?
Absolutely. So what you would get, you get we start with the metabolites, because that is the data that informs everything, right? That's the difference between just taking a look at someone and saying, well, I think you should eat more apples. Right. So you have the test data. So it starts there. Depending on where the markers are, we can adjust diet so that it includes some of the nutrients that might be missing, or that might stimulate certain bacteria to produce the molecules that might be missing. So, for example, one of the most important intestinal permeability markers that we look at is called indole propionic acid. There's a lot of literature on this. Again, in everything we do, it's all medically researched, backed. If anyone is interested, we have citations galore. So this all exists. But so IPA is the name of this molecule. And it's interesting because only very specific bacteria in the gut produce it. And they tend to be the ones that get wiped out first if you are doing bad things to your gut, whether it's, being on chemotherapy or being, stressed out or eating a crappy diet, candidly. So they're sensitive. Now, this IPA molecule, in order to get the bacteria to produce it, you have to actually feed them a different molecule, a precursor. So, you say, all right, in order to have these bacteria be able to increase the amount of IPA they're producing, you need to actually feed them indole lactic acid, which is what they take in. And then they spit out IPA as the byproduct. So what would we do? We would say, okay, if you have low IPA, and typically folks have low ILA, and they need to increase their ILA in their diet. And that comes from fermented foods, pickles, kimchi, sauerkraut, certain fermented foods have this in it. If you increase your intake of fermented foods, your gut will take that in. And as a result, it will increase the amount of IPA that you produce. So again, how does it work? It works by making very specific adjustments to your diet based on the markers in which are in and out of whack, in being able to say, okay, this is too high, right? We're going to counterbalance that by giving you this food instead, or lessening your intake of that. A really good example is with someone comes to us and says, I have trouble sleeping. Okay. And so you dig in, you say, well, what's going on? And you of course look at their results. Typically, not always with cancer patients, but just in general, let's say you have a person who is vegan or vegetarian. They're not consuming enough protein in their diet. So their tryptophan is low. As a result, tryptophan is a precursor to serotonin. Serotonin is typically low. Serotonin is a precursor to melatonin, of course, very important for sleep. So if you can correct the tryptophan, which typically then helps to correct the serotonin, now the person is sleeping better. So again, you have to, from these molecules, they all tell a story individually, but also collectively. Where do I begin and what can I do? Because if it's as simple as saying to the person, how much protein do you eat? I don't eat any protein. I eat salad all day. Say, okay, well, that's great, except that, you need to have these other molecules in here from your diet. That's why you're tired. You have brain fog. You're feeling anxious and you don't sleep well. Like it paints the picture. So there's that. We also have lifestyle and mindfulness recommendations. So for, especially I think in our cancer pilot, less emphasis on the fitness programs because folks, especially if they're in active treatment or are tired. And you don't want to
Sure.
just make that worse, of course, but you do want them to do some movement, some mindfulness, breathing, even just to, to take a walk outside. And so there are specific recommendations depending on which markers, again, are elevated. If some of the stress markers are elevated, is there mindfulness, meditation, breathing exercises that they could do to try to help reduce that physical or emotional stress, these markers, because their body's already being taxed. And those markers typically just show us that they're running another marathon in the background, and they don't need that if they're already, undergoing chemotherapy. We do also offer fitness plans that have been designed by Olympic caliber trainers with hundreds of videos and sequences and circuits, and I mean everything is included. These folks were outstanding when they designed them. But I'd say for cancer patients specifically, I think we focus very specifically on the nutrition and lifestyle management side more so than on the fitness plans.
That makes sense. Well, I'm just going to read a few of these statistics from the pilot program. 7.02 fewer days of fatigue per month for participants, 4.8 fewer days of brain fog, 42% reduction in the use of anti-nausea medications among active treatment participants, 57% reduction in the use of anti-constipation medications. These last two are really big for me, which is 86% of patients reported improvements in overall well-being, and 68% of patients noted better sleep quality during the pilot. And, cancer or no cancer, we all can identify with, you get good sleep, you have a pretty good life. You have extended periods of awful sleep.
Good sleep is the key to everything.
How's your day going? Probably not so great. So, I mean, those two, are pretty big. And so my question is really, as we've got to wrap this up pretty soon. I could talk to you about this forever. This is a really interesting topic, but what exactly, so once you have these statistics, can you, or are you making some sort of value-based argument for the kind of, value-based care for the kind of supplemental treatment, for lack of a better term, for this program? Are you emphasizing, have you been able to quantify, in other words, but the precursor question, you're talking about these molecules and precursor molecules, precursor question to that is, what's your business model? It's great. But I don't think you're just doing this out of, for society and all of it. That's great. But what ultimately is the business model, and how are you going to stand this company up and grow it for the future?
That's a great question. And currently, we're calling this the Ixcela clinic model. Currently right now, we are taking referrals from oncologists, physicians. So we're working very sort of specifically with the medical community. And, a physician will refer a patient. So an oncologist will refer a cancer patient. But to your point earlier, there are other conditions as well that we can, help with on the website.
Right.
So cancer is sort of our starting place, but this applies to GI conditions. It applies to metabolic health. It applies to cardiovascular health. Even mental health, because many of the same types of symptoms, whether it's, fatigue, brain fog, GI issues, sleep, affect people outside of just cancer, affect many of us, as you mentioned.
Of course.
The physician would refer the patient to us. We are currently in the process of being able to have the dietitian visit be covered by insurance, so that a patient, there's no pay out of pocket. The patient would be able to, use insurance in order to cover that. And the test itself, the test will not be covered by insurance. It's a kind of a bit of a headache to go through that whole thing with FDA. But we do have the ability also to, if folks just want to come in and work with a dietitian and start that way and have it be covered by insurance, that also can work. And then, if they want to spend a little bit of extra money on the test, but the test is really, really important because it does inform the dietitians for exactly what to do. It is quite critical to the personalization piece. But I think right now the model is working with medical providers who refer patients in for one of these conditions. And, they purchase the test and then they go on with us by doing multiple dietitian sessions.
And most of that is going to that's going to be patient paying the bill and those kinds of things. So I guess my question is ultimately, can you see, or is it part of your plans? Whereas if you make a very strong economic argument and a very strong argument for patient satisfaction, patient well-being, a lot of those things have economic consequences as well to the health system. Can you see sort of going to one of these systems like a Roper, St. Francis, and saying, for a per member per month or for a subscription fee or whatever exactly it is, we'll cover all of your patients coming through with our program. Is that something that you're aspiring to or looking to? And if I'm getting, I don't mean to pry into your business plans. I'm just trying to get a sense of where's the growth going to come from if this is, really successful, where that's going to come from.
It depends. So, the hospitals are interesting because they have their own model. So with Roper moving forward, currently the idea is that they are actually in the process of building an integrative wellness clinic within Roper that will use the Ixcela test as the primary testing protocol. They actually have their own dietitians on staff. So we train their dietitians in how to provide the results reviews, but they are using the testing sort of at the center, at the heart of their integrative wellness center. So for Roper, it's kind of again, everyone is going to be a little bit different in how they work with us, but outside of Roper, if you have different clinics, yeah, absolutely. Our goal is to go to different organizations, PE firms, and say, hey, you have this cancer center. We can just do this for you, right? Without you having to worry about it. And especially for specialists who this is not their specialty, right? If you're a gastroenterologist, your specialty is not nutrition and dietetics. And yet, how important is it to be able to tell your patient what they should be eating, right? Because that's probably why they're here to see you in the first place. So what we have heard is that, every kind of discipline is slightly different in the approach, but the idea would be to say to an organization, a clinic, a system, look, we can just do this. There's the test kit, there's the patient, the review, and then the patient, if it's covered by insurance, that's great. Patient can continue working with us for as long as they deem that it's useful. And that is the idea. Over time, if we can prove to payers, to the insurance payers, that there is value in doing this over, for example, them paying for whatever, more medications or this or that, then it may just be something that they were willing to cover intrinsically as part of the healthcare system. But we're going to have to prove that over time. So I do think the longer picture sort of model would be, if we can gather enough data to show that in different contexts, this program can actually save money to the system in some way, then it would be better investment for them to just invest in us rather than, paying for, an example, for example, John, would be, GLP-1s. GLP-1s are so prevalent now and they are expensive. And once you're on them, right, you keep taking them. What if we could show, and it's interesting when people are on them, some of the side effects, if you don't actually bother to change your diet or to do any exercise or whatever, there's, Ozempic face, Ozempic butt. I mean, there's all kinds of stuff because of muscle atrophy and muscle loss.
Yeah.
Because folks are just not, you have to do other things. It's not just take the medication. So, could you argue by doing this, could you reduce the cost of, the payer cost if you were to have them do a program like this? Yeah. We'd have to show it, obviously, but there are many areas where in the long run, if we can show, patients who do this, we reduce the hospital's number of ER visits, reducing their costs. We prevent patients from having to miss their oncology therapies and treatments. We, improve their outcomes. We shorten, the amount of time they feel like crap right after their therapies. These are all things that are of great interest also to the hospital systems, and to payers, because they're, at the end of the day, everyone's looking to streamline and cut their costs as much as possible while also maintaining a high quality of care. So yes, I think as we do this more, our goal right now is to find other systems, physicians, hospitals that are willing to do this with us.
That's terrific. So, last question: are they going to let you use the data for a paper, or is this going to kind of remain in press release format, or are we going to see this published at some point? The results of this pilot.
It's an interesting question. We haven't fully, the results were so positive and everybody was so excited to talk about it. We haven't had the conversation with them yet about what to do next and whether to, to publish a paper. Really, the work that was done here was, it wasn't like a clinical in-lab study. It was real work done with real patients who are really sick, right? And have cancer. This was not like, let's set up a model and see if we can tweak one little thing, measure something.
It's not an RCT.
Right? No, it was like, all right, we have people who are dying and are suffering. Like, let us see if this is actually going to help them, to make a difference. And so, I think everyone was just so excited about how positive the outcome was that, candidly, we haven't discussed whether we're going to turn it into a paper or not. So, I will
it's just the nerd in me, Erika.
No, it's not just you. I'm sure it'll be others who ask, well, why didn't we publish? This is a real life example of something that really helps people.
Well, I think the data are very, very, very important. I'm thinking of a company that I was involved with for a little bit. It was a reminder program for, text messages that had to do with colon cancer screening. So for that. And of course, a lot of people, they blow it off. They don't show up for their appointments because the test prep isn't fun. That's the reality. And that's why but they did something similar. And the fact that they had the real world data to be able to show the impact on this particular health system. I don't know ultimately where they ended up publishing. Eventually that particular company was sold off, I think, to Philips, but, I think it could really do you some good. I guess that's the point. If you're able to use this information in other contexts, I think a lot of other health systems out there would want to talk to you, and be able to replicate those results in their system. Now, whether they need to see it in the New England Journal of Medicine, I doubt that, but it's just good that you're collecting the data. I think that's really important. Erika, thank you so much. We've been going now almost 40 minutes. So I want to thank you again for your time and for taking the time. And how do people reach you if they want to get a hold of you? How do they find you?
Well, we're easy to find. So we're www.ixcela, ixcela.com. Lots of information on the website. And if you want to learn more, you can just schedule a time to chat with one of our navigators. Patients can also self-refer in. So I'd say our primary is getting physicians to do it. But if there's someone out there who is like, this is fascinating and it could help me in some way, or someone I know, just schedule a chat with one of our intakes, our navigators, and they'll be happy to chat with you about your challenge, your problem, and see if it's a good match. So Ixcela.com.
Excellent. So thank you again. And that'll do it for another episode of Healthcare Rounds. Our guest today has been Erika Ebbel Angle, co-founder and CEO of Ixcela. And as always, I'm your host, John Marchica, CEO of Darwin Research Group. Thanks so much for listening. Make sure to tell folks about Healthcare Rounds if you like what you hear, and we'll see you next round.